this research has provided some context in our setting here in the UAE. And as you mentioned, the saliva is as accurate or as effective as using the nasal swab. We are hoping that this finding can support further research and decision makers to evaluate and validate the use of the saliva as a specimen instead of the nasal swab. So there is genuine interest in the current states here, and we hope that this would be followed up as soon as possible. Thank you.
Hanan, when you think about this a bit more broadly, not just in terms of the potential to roll this out quickly here in the UAE, but a bit more broadly, you know, when I was traveling through Europe and the United States, we were still hit by the fact that every different country seemingly has a different method or test that they require for you to enter or to exit. How quickly do you think that with all of these vaccines that they're pushing toward the market and also this potential breakthrough with the saliva test, we could see things evening out a bit more, making travel a bit more easily done by the end of the year? Because that, of course, has impacts on markets, demand, and other things.
Yes, I think diagnostics, point-of-care diagnostic would help us a lot in having a more smooth travel and in and out from different countries. And looking at the research and looking at the different investments coming up in this realm, we will have more and more evidence that would support using easier, more simpler ways to test for the virus. The saliva is a simple, non-invasive method that can be used, and researchers in different parts of the world are looking at even more cost-effective, more affordable ways to incorporate this in the testing methods.
Absolutely. Hi, Dr. Hanan. It's Dan here in Abu Dhabi. With regards to the time that it takes to have the saliva tested, how does that compare to the nasal swab? Is this a quicker way of receiving test results?
In our study, we're using the same lab method that is being used to test the nasal swab. The major difference is that this is a more pleasant or less invasive way that the individual can use. It requires less strain on the resources from the healthcare sector in terms of wearing the personal protective equipment by the healthcare professionals. And it's a straightforward method where the individual would use the active drooling using a neat saliva within a simple container, and it really can improve the experience of being tested for COVID-19.
And I know it varies around the world, but here in the UAE at the moment, it costs about $70 or about 250 dirhams to be tested via the nasal swab. Is this saliva test going to be cheaper? And what does that mean for the effectiveness of testing overall in the country?
The research that we have conducted did not alter the lab method. So the price we just looked at the accuracy of using a saliva specimen instead of a nasal swab. So the price would not change if the lab process would not alter. There are different researchers looking at improving this bit and to decrease the cost of testing. And we're evaluating all this evidence as we go.